we wanted to take this opportunity to make an announcement. But before we get into that, I would like to introduce the members of the Macon County Healthcare Authority. I'm very proud to be associated with this illustrious group. It was a group of citizens who came together shortly after the John A. Andrew Hospital closed many years ago. And as a citizens group, they have remained on task for all of these years. And I just cannot say enough about them for staying the course. Even though our movement may have been slow and nil to some, it just says a lot about a group of people who can stay the course that long and make things happen in spite of everything. So our Vice President, Mr. Benjamin Rackley. Our next member is Dr. Ellis Hall. Ellis, raise your hand. Dr. Wallace Capel, Mrs. Myrtle Adams, Mrs. Della Sullins, and yours truly, Pat Clay, Chair. When the Thomas Reed Center closed almost 2 years ago, we have been busily working to try to get it reopened. The citizens have asked us any number of times, what are you all doing? We don't see any movement, what's happening? And we have continually said that we're working on it. We have tried many different scenarios and actions to bring this about. But today I'd like to turn this over to our committee. We had a committee that was appointed by the chair to go out and to test the waters, to see if we can gain some interest in what we were hoping to achieve. That committee consisted of Mr. Benjamin Rackley and Dr. Ellis Hall. And so at this time, I would like to turn it over to them to make some introductions and an announcement. Ben?
Thank you. It's a pleasure and privilege to introduce to you our CEO for the community hospital facility, Ms. Jeannie Reinhardt. Next to her is the CFO, Chief Financial Officer, Lee Greer. And to his left is Mike Wells, who's Director of Physician Recruitment. He didn't know I knew that title. But I know
I had one.
I know, and I won't use the word partner because there's some language that doesn't allow us to say that legally. But in reality, that's what we are. The announcement to be made is this, that there's a relationship that the Macon County Healthcare Authority has forged with Community Hospital, a group who's not far to this community, who's been here for years with a presence. And the relationship is so that the Thomas Reed Clinic will reopen under their management. I think that deserves an applause.
This is an honor for us. Good business is made on relationships, and relationships that are honest with each other and open, that agree, that you work through the struggles, as Dr. Hall said, to get to the finish line. And so we were so very honored and humbled to meet with the committee and to start this process. And believe me, it's been a process that we have been through, and for us to have been chosen is a great honor for us. We will not let this community down. We intend on being here for a very long time. We have had a presence in this community for many years, and we intend on continuing that, but not like it is. We want it to grow, and we want to provide the citizens of Tuskegee and Macon County and the surrounding area with the highest quality, best accessible health care that we could possibly do. And so we thank you, honestly, from the bottom of our heart. And I know Jenny and Lee feel the same way in our board of directors. And we just want to thank you for this opportunity. And we look very much forward to the grand opening of this facility. Thank you.
We're hoping August 1st, but it depends on provider number issues with Medicare and Blue Cross, getting all of that transferred over from our current location. We're already talking to other physicians about coming in on a part-time basis, specialty services. Right now the plans are for Dr. Hooks and Dr. Story to move over. Dr. House, who's a podiatrist that comes from Tallassee, 2 days a week
2 days.
to move over. And if things can work out, then Tom Crane and his rehab company move over, but that's going to take a little finagling on some tax stuff. So right now that's our plans. Dr. Rand is the new ENT physician full-time in Tallassee that we're talking to about coming here and possibly setting up hearing aid services there in the building as well. So, but we're looking at probably around August 1st. There's a plan for the urgent care. What we're going to do though is start off with primary care, and if we can partner with other physicians and maybe another outside company to provide that. That's not our, you know, we have emergency room and so forth, but it's got to work for us to be financially feasible, economically feasible. We do not receive tax funds in Tallassee at our hospital, so we've got to turn an income in order to stay open. And so, you know, this is our business, and we know how to make it run. And if we can make it urgent care after hours, around the clock, whatever, we told the authority that we would do that.